Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager, and I'm your host. I am going to be sharing with you in this episode some key takeaways that I left the Personalized Lifestyle Medicine Institute's conference in Chicago last week. Some of the takeaways I had from that I thought were really relevant to my current students and discussions I have with nurses and nurse practitioners about the functional approach. So, to set the stage, if you're not familiar with that conference, it is Jeffrey Bland, the father or now grandfather of functional medicine. He has the Personalized Lifestyle Medicine Institute, and twice a year they have an on location conference where everybody can meet up in person. The one that I usually go to in October is a little bit more of ideas that we can continue to process and figure out how it will fit in our practice in the future a bit more. And that the one that is in the spring is typically a little bit more about putting things into practice today. And that's definitely the case for this one. It was about clinical integration or clinical mastery, was how it was worded. And so it was a lot of things that are easier to take away and apply in practice immediately. And a lot of the things were really relevant to discussions that I'm having with my students. And as we have been building the functional nursing program, just taking a lot of the content from this conference and listening in and realizing that we're on the right track and that making sure that what we're incorporating and teaching our students is relevant and timely and current, that as things change, we want to keep adding things in. So I just wanted to do this episode where I can share a little bit of what I learned from the conference. First of all, the location was in Schaumburg, Illinois, so it wasn't really in Chicago. And I'm really glad to hear that next year it will be in downtown Chicago because Schaumburg's actually quite a trek from there. I know it's close to the airport, but my son came with me and he was kind of on pause for a couple days waiting for us to be able to go to the city. But we had a great time in Chicago. I love Chicago. It's so beautiful there and the weather was great. The conference itself was 2 days, and the topics that I thought were most relevant, I am going to kind of go through and share with you just some takeaways. And it also was Dr. Bland's 80th birthday just before the conference started. So there was a bit of a celebration for that, which is really exciting. So the first one that I thought it's come up at a couple conferences and I haven't mentioned it yet is Dr. David Perlmutter. If you're not familiar with him, he's a neurologist that is often a speaker at the PLMI conferences. And he was speaking about the idea of our microglial health and neurodegeneration. He listed over 20 brain health concerns, things like Alzheimer's disease and Parkinson's, and how the conversion of M2 to M1, when we're talking about our microglial cells, the health of them, that conversion is kind of a process that we can influence with a lot of the factors that we use with a functional approach, and that can impact our risk for developing these diseases and also treating them. And he talked about how when you actually look at the imaging that is associated with this, you can see the microglial activation in all of them, where the M2 is leaning more towards the M1. And the talk that he gave really was validating the root cause approaches that we use in functional nursing. And I thought that was really exciting. Basically, it was kind of like, this is just the list that I made note of, was things like addressing inflammation. And we know that that can come from many, many causes, infections, chronic infections in particular, or acute ones that aren't really resolved, insulin resistance and oxidative stress, treating mitochondrial dysfunction, which was a really big topic at the conference, addressing exposure to toxins and pollution. So really actionable things that nurses and nurse practitioners can incorporate in their practice, that it really leans back into that idea that if we go back to the foundations and work on those same foundational factors for our patients, that's what's really going to help move the needle for them. And the big takeaway, I think, was just that conversion of the M2 to M1 version of the microglia is reversible, and that we have an opportunity to play a role there and really help our patients to prevent neurodegenerative diseases or to help optimize their health when they are struggling with these types of conditions. And on that note of talking about neurodegeneration, Dr. Dale Bredesen also spoke, and he came was talking about this idea of connection mode and protection mode and identifying root causes for our patients and addressing them, also helping to shift the brain from a protection mode to a connection mode. And he in particular shared a case study where he talked about how working really closely with somebody on their health and using the functional approach had really helped to reverse their symptoms of neurocognitive decline. And then he had the patient come back with a recurrence of some symptoms. And they kind of did a dive again into their health history and found some new issues, things like a leaking roof in the house and some hidden mold exposure, sleep apnea that hadn't been screened for previously. They kind of redid the whole workup and found the new causes of the essentially same symptoms contributing to their health concern. I mean, that had essentially resolved before. They were much improved. And I thought to mention this because often in meetings I have with my students, we talk about order of operations. What do you help people with first? And the foundations and low hanging fruit are really great places to start. And that's almost always the right answer. The things that the patient thinks might be at the root. If it's something you want them to work on anyway, that's a great idea. Work on that. But we were talking recently in a meeting actually about how it's not like your patients are going to do what you talk to them about. They're going to go, you come up with a plan together, they go home and work on it. They're not just going to be better forever. Life is complex. And I talked about a case that I had where a patient had been really diligent in working on her health and felt great, hadn't needed to follow up in a while. And then when she did, she felt like she was maybe a little bit less strict with the things she had changed, but she felt kind of confused as to why a lot of her symptoms had recurred and some new symptoms had emerged. And then when we did that deep dive and kind of went back through the things that we worked on before, it turned out a lot of her lifestyle had changed and she had just gotten comfortable with it and not realized that she had a lot of new stressors and things going on in her life, things influencing like obvious like stress that we think of as stress, real stress, but also stressors on the body. A great example was she had had a family member move in with a baby and she was helping a lot and eating on the go and not chewing the way that she normally would. It was really foundational things that she wasn't realizing were impacting her health. And Dr. Bredesen kind of mentioned that where they didn't screen for sleep apnea the first go round. If they had, she may have had less of an issue emerge as a recurrence. But that's the reality of this work is that people are complex. They have a lot going on. When we do these really thorough intakes, we do our very best to learn as much as we can about our patients to give them informed guidance. But it's easy to overlook things. And that's why I think a really thorough screening tool like your intake form, having people do a very thorough one is really important because we can't work on all those things immediately, but being able to go back to it. And some of these screening tools, even revisiting them later, might get you different results. And maybe that was not an issue for them, and now it is. A great example would be if somebody's moved and their home environment is the cause, like in this case of the mold exposure, where they might be eating a really optimal diet, exercising, eating hygiene, working on their stress and sleep is optimal. They could have a lot of things that are really dialed in from working with you and then change one thing. Maybe they're, where they're working. So that's just something to always keep in mind. And I thought his case study was a really good example of that. There were a lot of great speakers. So I just want to acknowledge that I'm just kind of sharing some pearls that I thought were really relevant to my students. Dr. Phyllis Zur is an expert on all things sleep. And the big takeaway that I got from her was a lot of the speakers were talking about circadian rhythm, and that has come up a lot in the functional space in the last year or so in particular. She was speaking mostly the influences of circadian rhythm and sleep on our health, and also that idea that we talk about in functional nursing. And actually, our students, at the same time that this was going, the conference was going, our students were learning a lot about hormone balance and about cortisol and melatonin rhythms, and actually shared some recent research that reveals that even when we're asleep, The way I envisioned it was if you're asleep and a timer goes off that turns your light on in your room, even a small amount of light. So your eyes are closed, you're asleep, you should not be able to be aware that that light is on in the room. But somehow our bodies are capable of doing that. She was able to show some significant research that highlights the impact on our metabolic health in particular. And a lot of different biomarkers that we use in the functional approach were elevated significantly in the group that was in the rooms that had light exposure. That's not saying the lights were completely on in the room. It's like having a night light on, having small amounts of light can really influence our risk for developing things like insulin resistance and diabetes or heart disease. So I thought that that was extremely significant to most of us and something that we can share with our patients. I think it's something that a lot of people dismiss or don't even think about that they have lights on in their room. I've talked to several people since then about the topic and everybody's like, "Oh yeah, I definitely have lights on and I don't even think about it." Definitely something that we can all be talking to our patients about. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. Okay, so there's one talk that I'm going to have to spend some time processing before I can really share it with my students in a meaningful way. But Dr. Patrick Hanaway is an expert in gut health and the gut microbiome. And he was really sharing some kind of protocol shifting. I don't like the word protocol, but there's ways that we approach gut health in the functional space. And he's been one of the primary people teaching that for decades. And he has kind of shifted his thoughts on it to how we should be introducing things in different stages and that we should consider like anaerobic and aerobic metabolism when we're thinking about what we're introducing and the role that plays on the gut. Maybe we might be introducing probiotics too soon in that process, and that could be a strain on the system or not effective, or that we could instead be introducing things that are metabolized more effectively early in the process and introduce those later. I'm going to have to go back through that one and kind of like figure out how to change the guidance that we as functional nurses are giving and how we're going to be treating gut concerns moving forward. But that was kind of like other people that I talked to at the conference were like, oh my gosh, I'm going to have to rewatch that and really rethink how I'm going to recommend my patients stage their treatments for gut health. That one was, I can't even say it all yet because I need to wait for the recordings and revisit it, go back through the slides. So then Dr. Ashley Koff, I heard her speak also. She was at IHS and she often speaks for PLMI. So she is a registered dietitian and she's an expert in nutrition. Obviously, in this talk, she was talking about how taste is an important factor. I wanted to talk about that. And also, first, she just kind of was talking about how maybe we've over villainized omega 6s. And there's definitely crummy versions of omega 6s that we could have our patients avoiding. We need omega 6s in our body, but most of us tend to consume too many of them and poor quality omega 6s. Rather than saying that they're evil or saying we should avoid them altogether, we could really focus on educating our patients on quality sources versus the ones that are more likely to contribute to an inflammatory state in the body. She, in particular, pointed out that they help produce the specialized pro-resolving mediators, and we need those. We do want to have omega 6s. Typically, my guidance when I talk to people about it is that we tend to consume too many of them. It's not like we need to worry about adding more in, but we do need to worry about the quality of them. But they do, work in a balance with our omega 3s. And that's usually what we need to focus on adding more of is our omega 3s in our diet. So the thing that I thought was more interesting that she talked about was like research around whether we eat food that we think is delicious or not. And that when food is delicious, is we are more likely to recognize when we're full and consume less total intake calories wise. We're less likely to overeat if the food we eat is something that we consider to be really great. And if our body isn't satisfied with the taste of the food, we are more likely to keep eating and overeat. And that one is another one that I think is just so relevant and easy for us to educate our patients on. I don't think our patients are going to be too bummed to hear that they should be focused on eating foods that they find to be delicious. The scale that she offered as kind of a measure for that was if you're eating something and you don't feel like it's at least a 7 as far as excited to eat it and it's delicious, then recognize that and maybe choose something different when you can. Also, if you have an amount of something, she was talking about a client of hers that I think it was Reese's Cups. It was some kind of candy and that she was eating a lot of them. She said, I'm not going to tell you not to eat those anymore. I'm going to tell you to stop eating them when they aren't a 7 for you anymore. The gal that she was talking to, I think, had been eating like 5 or 6 of them a night and found that when she was just mindful of that, at what point in 1 through 6 Reese's Cups was she dropping off from a 7, or it was less than a 7 for her as far as satisfaction and taste. She found that she was only eating 1 or 2. It drastically changed the amount of them because at some point we just often will mindlessly eat and we don't need to continue eating things. I thought that one was just in particular really actionable. We have had companies reaching out to us about electronic health records recently, and I'm having a lot of discussions with students about using AI in their practice. The last thing that I wanted to share that I am going to need to learn more about, but I just wanted to kind of share that it came up in the conference is Dr. Peter Kozlowski was talking about this software, Hans AI, and it is used for functional interpretation. It can help write soap notes. It can help like give you a protocol. Essentially, it has been fed evidence informed functional approaches, information, research, supplement dosing, lab ranges that are optimal versus standard labs. It is an AI software that understands the functional approach really well, and it is capable of taking information that we can feed it about our patients and then producing some guidance, interpreting labs. He did a case study that he walked through and showed the several tests that he would do for a patient. We kind of broke out into small groups and talked about what would our approach be, what tests would we want first on the patient based on what we knew. Then he showed the results that he had gotten. Then we kind of talked again, like, what do we think might be going on? Then it showed AI's interpretation of what was going on. And we talked about how we would treat it. And it showed what the software said to do to treat it. It was, very accurate. Um, and then beyond that, it was able to write a SOAP note based on the information that it was given. He did point out it knew only what it was told. I signed up because the software isn't available yet, but I signed up to have early access based on being an attendee at the conference. I'm going to check it out. I have a couple other companies that are talking with us at IFN about the types of software that they have incorporated into their electronic health records to try to make all of that streamlined and in one piece of software. But I think it's a really important thing. The conferences the last few years have been talking about where AI fits. I saw a court ruling recently that said for lawyers using AI, everything that is in the AI that they use for their work is admissible in court and it isn't protected under the attorney-client privilege. I think that sort of consideration really needs to be something that we keep in mind too. I don't have a huge opinion on like all of that yet. It's just something that I've been thinking about is, um, of course we're going to de-identify things. That's really important if we're using AI. But what is, the ethical and legal implications of using AI in our practice and which softwares are going to set us up for success there and which ones might have some potential risks involved. So I'm excited to learn more about it because I think we all know that the functional approach can be kind of cumbersome. A lot of it, I talk to students all the time about like, oh, upload my labs over here and then track things over here. And then I go over here to order supplements. And we have several companies that we work closely with that have many solutions to this, but I think that there's always room to improve productivity and create space for us to spend more time face to face with our patients instead of looking at computer screens, and also enjoying our personal time. So it's exciting thing to explore and try to figure out what is the best approach for the majority of the nurses and nurse practitioners that I know. I'm excited to take a peek at those and learn more and then share what I learned from that. These are just some of the highlights of what I took from that conference. As I always tell my students, PLMI, they have their membership where you can watch their recordings through the year, and it's really cost effective. If you're interested in hearing more about all the things that I just mentioned, we'll be incorporating them into our program moving forward. As always, I try to stay as current as possible. But also, you can sign up for PLMI's annual membership and have access to the recordings when they're available, which should be in the next month or so. Anyway, I hope this was useful information for you and that maybe it inspired you to attend next year or to consider signing up for their membership and check it out. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.